The World Health Organization said on Monday that COVID-19 pandemic still constitutes a public health emergency of international concern, the WHO's highest alert level. The announcement came amid the recent increase of weekly reported deaths worldwide.
After its quarterly assessment meeting on the COVID-19 pandemic on Friday, the WHO's International Health Regulations Emergency Committee said in a statement that COVID-19 remains a dangerous infectious disease with the capacity to cause substantial damage to health systems. It also acknowledged that the COVID-19 pandemic may be approaching an inflection point. The committee said although infection or vaccination may lead to higher levels of population immunity globally and limit the impact of morbidity and mortality, there is little doubt that this virus will remain a permanently established pathogen in humans and animals for the foreseeable future. It then called for a long-term public health action that will prioritize the mitigation of COVID-19 impact on morbidity and mortality. Meanwhile, the committee recommends that countries should achieve 100% vaccination coverage of high-priority groups, improve reporting of SARS coronavirus second surveillance data to the WHO, and ensure a long-term availability of medical countermeasures such as COVID-19 vaccines, diagnostics, and therapeutics.